You may have topped up your tan over the summer, but did you consider how dangerous it could be?
Yeah, new figures show the number of people admitted to hospital for skin cancer treatment in England's gone up by nearly a third in just 5 years.
In a moment, we'll discuss this with Dr. Walayat Hussain, a dermatologist at Spire Leeds Hospital. First, though, let's look at how we thought about tanning in the days before we knew about the effects.
From 5th century Vikings to 20th century sun worshippers. Go to any beach or open-air swimming pool these days and you'll find them there by the score. People who go very often, not to swim, but to get a tan. And why not? After all, as they say, too much bathing weakens you. But notice how highly technical it's become. Not only do we use suntan oil and cream, but scientific aids like this aluminium foil reflector.
And Dr. Hussain's with us
Things
now.
have changed,
I know
haven't they?
have.
Morning.
Well,
Morning.
things have changed because we know more about the effects of the sun on our skin. Also, has the strength of the sun changed since those days?
Not really. I think we're just seeking the sun more than we ever did before, I think. And certainly the strength of the sun's been the same. It's just there's more pollution actually in this country than there was before, probably. So we're going elsewhere to seek our sun. But the worrying thing about these numbers is that the alarming rates of skin cancer, they're still on the increase, and as a dermatologist, public education is at the forefront of what we're trying to do.
OK, so you have seen many more people, have you, with these different types of skin cancer?
Absolutely. Up and down the country, the UK is experiencing a tsunami of skin cancer. Dermatology departments are almost overrun by the epidemic of skin cancer that's taking place. Part of that could be that actually people are more aware, they're going to the GP sooner, but there's no doubt that the rates are on the increase.
How can you check yourself?
It's about just knowing what to look for. So the things
you can see pictures actually of various different moles here. So
absolutely. So the bottom line is that if there's anything on your skin which you're worried is changing, you should go and see your GP. We teach people about changing size of a mole, the colour, the shape, any symptoms such as itching or bleeding. The bottom line we use is, if in doubt, check it out. The skin is readily accessible. You just need to see somebody who knows what they're looking at, because early detection is the key to cure.
And what happens if you go to your GP with mole? You get sent on to someone like you? Is that what would normally happen?
It depends what the GP thinks. If they're very happy and they're confident in skin diagnosis, they will reassure you and give you some sun protection advice and send you on your way. If, however, they're not clear at all, or they're worried it may be suspected skin cancer, you can be seen in a hospital by a specialist within 2 weeks. So it's a rapid access system that we have. And one of the worrying things that we have is that people often just sit at home and say, well, it's only something on my skin, I don't want to trouble my GP. And that's what we're trying to get away from, because early detection is the key to cure.
You need sunlight as a source of vitamin D sometimes, don't you? Absolutely.
I mean, the thing is, this whole vitamin D debate is absolutely out there, and sun protection is important from that viewpoint. And you can do things to supplement your vitamin D if you're running low on that. But yeah, you're absolutely right. There's quite a controversy at the moment around the world about vitamin D and sun exposure.
OK, so what do you think is the main cause? Is it because people are getting tans? Is it because they're using sunbeds? Or is it because they're getting burnt when they're tanning? What would, is there a kind of catch-all, the main problem?
All of those things you mentioned are actually relevant. If you have a family history and your genetics that you're fair skin and you tend to burn very easily, you're more at risk of skin cancer. If you use a sunbed, then that automatically increases your risk of skin cancer. And actually, even if you don't burn with those sunbeds, you still increase the risk of a type of skin cancer called a squamous cell carcinoma. Melanoma is the most serious type of skin cancer, which again is related to sun exposure, but chronic long-term sun exposure also increases the rates of skin cancer. So all the things you mentioned are very relevant indeed.
It's a bit late in the summer to be saying this, but is there a safe limit where you can say, look, I'm going out for 10 minutes in the sun, I'm sure I won't be getting at risk of a melanoma?
Well, the problem is that everybody always gets caught out, and there's no such thing as a safe, healthy tan. And a lot depends on what your skin type is like. Very fair people who are freckly, have got red hair, blue eyes, they're more at risk of burning. So even a short amount of sunshine, even in September, can catch you out.
OK, so you're saying that early detection rates are really important. What are the sort of cure rates? How are things going?
Well, cures, in terms of, it's all about at what stage you're being diagnosed, and that's why early detection is so important. For melanoma, which is the most serious type of skin cancer, we still have 2,000 deaths per year in this country from that. But what we're looking at, the thinner they are in the skin at the time of diagnosis, the greater the chance of cure. The longer you've left it and the deeper it is in the skin, the less the chance of survival.
So, as you said, if in doubt, check it out.
Absolutely.
Dr. Hussain, thanks very much. 23 minutes to 9, you may have been topping up your tan over the summer, but did you take a moment to consider how dangerous that might be?
Well, new figures show that the number of people admitted to hospital for skin cancer treatment in England has gone up by nearly a third in just 5 years.
Well, here's a look now at how we thought about tanning in the days before we knew more about its effects.
From 5th century Vikings to 20th century sun worshippers. Go to any beach or open-air swimming pool these days and you'll find them there by the score. People who go very often, not to swim, but to get a tan. And why not? After all, as they say, too much bathing weakens you. But notice how highly technical it's become. Not only do we use suntan oil and cream, but scientific aids like this aluminium foil reflector.
And back in those days, you didn't have your factor 50, you just
No,
had
but
the ordinary oil.
Or just put on, not, yes, exactly. I remember those days. Well, let's speak to Dr. Walayat Hussain, a dermatologist from Nuffield Health at Leeds Hospital. Things have changed a lot, but are you concerned by the number of people you are seeing with dangerous skin cancers?
Absolutely. I think up and down the country, dermatology departments are being flooded by this tsunami of skin cancer. It's an epidemic up and down the country. There's no doubt it's on the increase, and one of the things about skin cancer, it's readily preventable. Early detection is the key, but absolutely we're being inundated with skin cancer referrals.
And is it because the weather here is so much hotter, or is it something else?
I think actually there's a number of factors going on. We still have sunbed use in this country, which is an absolute disaster when it comes to skin cancer risk. People are going for holidays abroad over a long bank holiday weekend. It's much more accessible to have these short package holidays. And the other thing is actually, when we do get a bit of sun in this country, understandably, people want to go out and seek that sun because we don't get it that often or as often as we want. So there are a number of factors going on.
And what about vitamin D in this whole argument? Because there are people who are expressing concerns that we're not getting enough.
Absolutely.
And sun is a part of that, isn't it?
Vitamin D and sun is an important factor here, but the bottom line is you can always supplement your vitamin D with tablets if you need to. The role of vitamin D in skin cancer and all that stuff is actually all quite controversial. There's always different guidelines coming out, but I think the best thing to do if you're at all concerned about your levels of sun protection and your vitamin D levels, go and speak to your GP. If they're concerned, they'll refer you on to somebody who can give you better advice regarding that.
Early diagnosis is really important, but as you get older, you get more and more moles, so it's hard to tell what's all right and what isn't.
Absolutely, but this is such a key factor to early detection. It's about patients taking responsibility for their own skin. The saying that we have is, if in doubt, check it out. I would much rather see 10 benign moles in my clinic and reassure people rather than them sit at home on that one mole which really did need to be checked out.
OK, so I mean, what do people look for then?
OK, so any mole which is increasing in size, shape, changing colour, itching, bleeding, or any sore on the skin which isn't healing. This is another thing that people just think of skin cancer developing from freckles, but there are other non-melanoma type of skin cancers which can just be a non-healing ulcer on the skin.
People with different skin types, of course, react differently to the sun, and obviously pale people burn much more quickly. So is there a safe amount of sun that people can take? Say, look, if I go over 10 minutes, I'll be free from skin cancer.
Well, I think it, again, depends very much on your skin type, as you alluded to. People who are basically very fair, pale skin, blue eyes, blonde hair, they probably won't be able to take very much sun and they burn readily easily. Somebody like myself or somebody with darker skin can tolerate this a little bit better. But the key thing is there's no such thing actually as a healthy tan, because that's actually a sign of sun damage to your skin.
OK, so what should people be particularly looking out for? Is it burning that's a real priority for you?
Burning is a priority, but even chronic sun exposure can increase your risk of a type of skin cancer called basal cell and squamous cell skin cancer. So sun exposure generally, and actually tanning itself, there's no such thing as a safe tan, as I said.
So what we really need to work out is a way to say that having pale skin is as attractive or more attractive than having tan skin.
Absolutely. I mean, I think there's been a massive development recently in the fake tan, and I think it's becoming a little bit more acceptable. There's more and more celebrities using it actually, which is good, because that's actually going to be the safest way of getting a tan out of a bottle rather than from the sun.
Thanks very much for your time here on Breakfast.
Thank you.
Thank you.